Today I'm going to prep some meds for Mr. Johnson. I'm just going to check this medication drawer against his MAR. Ben Johnson, March 31st, 1993, March 31st, 1993, medical record number 3133, medical record number 3133, okay? I'm going to look at his drugs on here. The first one is dextrose, but that's for him being hypoglycemic, and he is not. The labs show that his blood glucose level is 382, so we definitely don't need to give that right now. The next med up is escitalopram, so I'm going to go on and get that out. It is for Ben Johnson. Escitalopram, 20 milligrams. Escitalopram, 20 milligrams. His dose is 1 tablet. So there's one of these. This is not expired, it's not open, anything. It's still an active order. It's given daily at 0800. It has not been given yet, so we're going to go on and give that to him. The next thing I'm going to grab is the influenza virus vaccine from Ben Johnson's medication drawer. So influenza virus vaccine, 0.5 mLs is the concentration, 0.5 mLs is the dose. That is still active. It is given once, and he has not been given that yet, so we're going to get that out for him as well. The next one is ondansetron, 4 milligrams. Ondansetron, 4 milligrams. That's an oral tablet. It is 1 tablet right here. It's PRN Q6 hours. He has not been given that yet. This is given for nausea and vomiting. We know that he's had nausea and vomiting. This is still intact, it's not expired or anything, so we can go on and give him that as well. Just going to go on back to the influenza virus vaccine and make sure this is an intramuscular medication. Just want to clarify that. Okay. The last one on his list is regular insulin. Regular insulin, 100 units per ml, 100 units per ml. This is an active order, as directed. We know that this has been dosed based on a sliding scale, so let's go to his labs. Double check on his blood sugar, 382, super high. So based on the sliding scale, a blood sugar of 382, so blood glucose 350 or greater is 20 units. We're going to call the physician as soon as possible because that's super high. This is a subcutaneous injection. So we're going to have all those out. The next thing I'm going to do is prep my meds. So I'm going to start with this insulin. I'm going to clean this really good, let it dry completely. This out. Take the cap off. And again, we're going to give him 20 units, so I'm going to pull back 20 units of air. Just a little bit more, so I make sure I get enough. I'll push that air back in there, slowly pull it back out. Okay. Cap that with the scoop technique. Make sure there's no air bubbles in it. Make sure I'm right at 20. No more, no less. Okay. Since insulin is a high alert drug, I'm going to get another RN to verify this with me. Can you tell me how much you see?
Yeah, 20 units.
Okay, and if you will look at his labs, his blood sugar was 382 right there. So I'm going to go back to his meds. This is based on a sliding scale, so tell me how many he would need.
Okay, his blood glucose is 382, and for 350 or greater, he needs 20 units, and for you to call the physician, so okay. That's right.
All right. So I'm going to have this. Since insulin is always in this orange cap needle, that's a universal everywhere, I do not need to label that. So the next one that I'm going to prep is the influenza virus vaccine. Always clean the vials first. Make sure I get it really good, make sure it completely dries. I've chosen this needle. It is 23 gauge by 1 inch. We knew by his chart that he weighs 168 pounds, which is roughly 76 kilograms. So this is an adequate needle for that size of a person. I'm going to open this, making sure not to touch the end of it, and keep that sterile. I'm going to open this one, do the same. Connect those two. Take the cap off. Okay. Well, I forgot to get some air in it, so I'm actually gonna redo that one. I'm just gonna take that back off. We're actually out of that needle, but we have a 22 gauge by 1.5, and that's also an adequate size for him. So keep that sterile. I'm gonna put that back on. Draw up. He needs 0.5 ml, so I'm gonna pull up that much air. Maybe just a little bit more in case I get an air bubble in it. Just gonna go on and re-clean that just in case, since I've already touched it once. And let that dry again for 15 seconds. Make sure it's nice and dry. Push that air in there. And then draw it back nice and slow. Got a little air bubble in there, so I'm gonna pull back a little bit more. Scoop that, cap it, make sure not touch the end of that. Make sure I get these air bubbles out. And I'm gonna push the excess out. Okay. Next thing I'm gonna do is label it. I have my label right here, the influenza vaccine 0.5 mLs, IM, once, time is now, and the date, patient's initials. I'm just gonna label. Okay. The last thing I'm gonna do is go back over and do my second check of the MAR. This all came out of Ben Johnson's medication drawer right here. So the first one, escitalopram 20 milligrams, escitalopram 20 milligrams, that is oral tablet. He gets one, it's still active, given daily at 0800, and it's not been given. It's still intact, it's not expired. The next one is the influenza virus vaccine. Influenza virus vaccine, 0.5 mLs. Once not given, so that's good to go. The next one is the ondansetron. Ondansetron, 4 milligrams, 1 tablet, active, PRN, Q6 hours. It's given for nausea, and we know he was complaining of that, so we're going to give that to him. Intact, not expired. And then insulin, it's already been checked once by the nurse, another nurse, because it's a high risk. We're right at 20 units based on his sliding scale. His blood sugar was 382, and we made sure we called the physician. And I have them all ready to go.